Bismillah ar-Rahman ar-Rahim. I'm very happy to meet you again for this continuation of lecture for the 40-year student Community Medicine Department of Misrata Medical School. Dr. Omar asked me to discuss with you the child health, the mother health, and school health and adolescent health. We'll talk first before we start to talk in details about child health and mother health and adolescent school health. Maybe we'll talk about the health system as a whole before we go in details for all specific group. Hopefully the slide will be clear on your side. Let's talk about health system management, but I'm speaking only about the health system. Structure of it, not the management. Management, Dr. Omar, I think, will take it. I'm just explaining you how we can utilize the health system, proper health system, to support the child health and the mother health and the adolescent and school health. The health system recognized by the WHO, World Health Organization, and its constitution, and a definition of health as we discussed in the lecture of immunization, and health and related to human rights. This for child, for the mother, for adolescent, for elderly. Everybody in the community has a complete right to have the best health service possible. And the role of the government to support the community members. Health Institute is a component of the health system, which we'll explain today, health security and health development. The other two topics we'll talk maybe later on in another lecture. Health system, by definition, all parties or individual or organization related to health service in the country and controlled by six elements to run the health system in a proper way. First, have the proper management with good the government, the stewardship to support and to run the program, the system. And mainly the function of the government body, put the policies, the strategies, the plans, the indicator, the follow-up, the monitoring, the accountability. And of course, this institute or this system needs a human resource. On all aspects of a human resource who can work together to run the system. This health resource manpower should be efficient, effective, competent to be able to run the system. And of course, they need financial resource. Without financial support and social, the system cannot work. And of course, the system to work should depend programs and service on information, proper and right and correct information, data, statistic, research, surveys, studies, what's called HIS, Health Information System. Without that, you cannot make a proper decision at the proper time and a proper place. So the right decision, right time, right place, it depends on the information and the data and the statistic and the research and the study. This is what we call evidence-based medicine, evidence-based policy, evidence-based decision. Without that, we are doing some haphazard, randomly service which cannot produce any effect on the health of people. Of course, this health system is technical programs, need technical support, mainly equipment in all aspects of service, laboratory, pharmaceutical, medication, equipment, machines. All the technical and health technology should be in a high standard and very efficient and very effective. And all of these 5 things can work to produce a service, a package of service, which be able to deliver by the system to the people. The service should be efficient and effective and good enough to cover as many people of the community as possible and as many health problems as possible without make people facing a lot of suffering and stress. As you know, I am sure, the level of health service, there are 3 main levels. The best and the first and the essential part is the primary health care, BHC. This is without it cannot have health system. This is the most important, and Dr. Omar, I think he will talk to you about primary health care in more details. And in my talk last time, I mentioned about the Ma'ata Declaration would support and establish the primary health care as the main tool of health system to cover the health need for the community. Simply, the primary health care run around 80% of the health service and cover 80% of the population. And the easy contact, the nearest contact to person to the health system. Second, secondary health care programs or service is mean inpatient in the hospital or specialized clinic outpatient. Tertiary is a very specialized, very advanced, very complicated service like transplantation, cardiac surgery, dialysis, all the technically delicate and fine touch health service. Without it, you cannot take care of the severe and the complicated patient. What the main job of the health system? They mainly work for health promotion, and this will talk about child health later on. Health protection, الحماية الصحية, preventive programs, curative programs, rehabilitation programs, and maybe number 6, the palliative programs, which deal with the terminal cases, people who are in the terminal stage of their life and they are very sick, need special program to cover their needs. The health system tools to produce these functions need good policies, good planning, choosing priority rights at the right time. Delegation, have the spirit of delegation of authority, cannot be controlled centrally by one person, one man show. Should be delegate authority to people who really face the problem in the ground, in the field. And distribute authorities, authority, not just authority, with responsibility and accountability. Any person have some authority should have responsibility limited and job description clear, and of course the system have some accountability and audit, supervision, inspection, documentation of any error in the service. Decentralization is a very important aspect of the health system tools, that all the services should be distributed equally and efficiently to all parts of the community, and each part have the right and the authority can deliver what the people need in its area. So the human being, the individual in El Qatron, in the south part of Libya near Chad, and Msaad, the border with Egypt, Ras el-Jair, border with Tunis, and the north side, Kufra in the south east, and at the north, not only the capital and the major cities, Tripoli, Benghazi, Misrata, Zawiya, Darna, Bayda, Ghalian. We have to cover all each part in the country. Partnership is very important aspect of the health system tools. Without partnership, without stakeholder groups can work together to help each other to produce better services to human being, cannot work. Partnership with the private sector, with the NGOs, with the charities, fundraising, international organization, national organization, fundraising, donor, community, and have to find good fund to the health system. Can we make us say this health system successful if we had this element about 8 or 9? The system should be efficient, utilize the resource you have in an efficient way, and effective, produce result, produce effect on the people's health. Could be efficient but not effective. But here we have to be more efficient and more effective. Quality, a high standard of service according to accreditation and standard can be assessed. Transparency, this is very important. The system should be crystal clear. Everybody knows exactly what the other people do. If any error, we know exactly where is the error, how can correct it. Should be in a very transparency. Transparency need good documentation, good database, good IT system, good paperwork to document each step of our service. The wrong and the right doing things should be recorded. And sustainability, our work should have the spirit of continuation. We cannot work for a couple of months and collapse. And this happens in many health systems when they have some donation. They make fantastic work, but they know that the fund is limited. So once the fund is stopped from the donor, everything collapsed again, be worse than before. So in our planning, our own policy, our decision making should rely on the sustainability. الاستمرارية خير الأعمال أدومها ولو قل. Monitoring, we should have our indicators to know exactly where we are going, that have this indicators should be qualitative and quantitative. I'm sure Dr. Abdurrahim, one of the colleagues maybe, will talk a lot about the monitoring system in health programs. Otherwise, I'll tell you in more details if Dr. Omar asks me for that. What does mean indicator, what mean qualitative, what quantitative, the mixed, per proxy. It's fantastic programs. And the system should be fair enough, equity and equality. And the three terms, they are matching, but there are some difference between equity and equality and between fairness. The indicator which we talk about it, that reducing the mortality, the morbidity, the disability, and the most important, the suffering, the stress which people face when looking or need health service. We have, if a health system cannot reduce the mortality, cannot, like what we have done with the polio and the measles vaccine, with the dramatically reducing the mortality. That's why we are happy with vaccination program, because the main aim of it to reduce the children mortality because of this measles, diphtheria, pertussis, meningitis, pneumococcus, name it. Just can control it, reduce it dramatically and clearly by the vaccination. So it's a fantastic system. And secondly, reduce the morbidity and disability, like a polio, like encephalitis, like a meningitis, which make children disabled. Vaccine can do that. So it's a successful program. And this is applied for the whole system. And plus, we will talk about mortality, morbidity, and the suffering. Suffering, of course, financial or social or logistic or psychologically. This should be controlled. Otherwise, the system is failed. and the citizen, the individual, should be the center part of the system. Should we look for the individual, how we served him in the proper way and very efficient, as discussed, effective way. Community should be the center of our programs. If we did that, we'll assure the citizen will give us trust, their confidence, and to rely on us. And this means the system is successful. And the system should be accessible, available, affordable, in a simple way for the whole population. What we need, the role of community. Community should support the health system, to make health in all policy of the community, of the government. Any policy made by education, by agriculture, by finance system, by economic, we have to find where is the health problem within this policy or plan. What's for health and what's against it. How much health can help us to improve our economic situation. So always health in any policy we plan to do it, that health be in the top of the priority. And for individual, for groups, health should be as a headache and concern for everybody in the country. Health is for all, so everybody should enjoy best level of health and should share and buy all, and everybody should contribute to the health service. And the financial resources, which we mentioned in the beginning, that the health system need a lot of support financially, and the GDP, the gross domestic product, and GNP, the gross national product, this is an economic and financial authority, should give a portion to the health system as reasonable and good enough. Most of the developing countries give very little support to the health system financially from the GDP. They are 2.5, 3, maximum 4%. The developed country, they give it more than 10. Some country 12, 9, 17 in America from the GDP only for the health system, for the health service. The problem in our country and many countries, not just because the little money the authority pass to the health service, but even that little money, utilize it and use it very bad way, very waste, very unscientific and logical way, without good plan. And the most serious one is the corruption. Plus, we are not planning very well. We use it in a randomly and bad way. We lost a lot of resources, either human or financial. The worst thing is the corruption, intentional loss of money or advantage of the system for the sake of some people. Adoption of think tank. Each country should have some committee or system just to think about the need of the health system. Establishing and reinforcing institution culture. The mentality of people working in the government, the cabinet, should have the mentality of institution, not the tribe or the family or the city. The job description, the hierarchy should be the plan advantage, what for you, what's against you. It should have mentality of institute. What the main function, the aim of the system is to achieve what they call universal coverage for every citizen. يعني your first coverage التغطية الشاملة mean that everybody in the country should have good support and service, as many as possible of population, as many as possible of the had the problem, without as lowest level of suffering, financially, as we mentioned, psychologically, socially, and logistically. For the finance, I think we discussed, like here maybe we talk about the health system probably should have what good prepaid payment. The person who go to health service should think about his pocket, that he be assured that all the service he need will be done without asking him to pay, because the payment already prepaid, already done by the insurance, by the tax, by the government, by the fund, trust. There is a system that everything, just you produce your national number or your card, that you go to the system, so you don't worry about if you have some problem person, acute abdomen, cardiac arrest, fracture, trauma. You shouldn't think about money. You go to proper hospital, proper time, and the proper service should be delivered to him without asking him for the money. Because many people in our community they reach what called catastrophic expense. What does mean? Does mean that this family spend more than 40% of their income for the health need of their people or their member. And in many countries, at least 2% of the community each year reach the level of poverty because of the health expense. If we have the prepaid, we will not reach catastrophic expense and will not go to poverty because of health. Because the community government take care of collection of proportion from each person through the tax or through insurance. They have to find some system, and there are many. Each country has its experience. Egypt different from UK different from Germany, different from Japan from United States. But at the end of the day, everybody looked at their members will not suffer when they need health service. By health insurance, it's either general or specific, or by taxes, or by private or trust fund. And integration is a very important part of the health system, between the levels, between the organization, between the authorities, between international and national organization. When the system be fatigued and unable to work, we have to produce a result, we have to do some reform. And this is normal. Each international organization, WHO, I worked in it, every 10 years they have committees for the reform. The words we're doing wrong and we're doing right, why people not accept us anymore, why we haven't got a better indicator and the result and outcome of our work. So they have to reform. And in many third world country, they understand reform in different ways and to change for the sake of change, just a cosmetic, which make no difference for people. But they change the office, the rooms, the building, the names, the department, but in fact what's inside is the same. And development is good, but it's not the proper reform. It's just improvement, like what good improvement or modernization and correction if there's some error here there. It's so good, but if all these changes, reform, and these changes, development, modernization, improvement, and correction cannot work, we have to go to reform, where we have to make major change in the tools and inside the institution. If all this failed, this means the system completely collapsed and no way the system can help. This is what called the revolutionary way of thinking. You make something else, you make a new system, you make a new change, major things, not just superficial. I discussed with many colleagues to sort out the problem of the Ministry of Health. We have to do what we call higher Council for Health, with the control of the health not by Minister of Health himself, but by the Prime Minister of his deputy. Minister of Health only and Secretary of the group, and Minister of Education, Minister of Higher Education, Finance, Social Affairs, Minister related to sport and young people. All of these can help to have the sport. The planning system, civil societies, and these all meet on a regular basis and can support the Minister of Health in the decision-making level, either in the Parliament and Cabinet, the legal department, that's supported by this committee. And this will take only the more major problem, chronic problem, complicated problem, and some independent organization like quality, like insurance, like Food and Drug Association shouldn't be controlled by the minister himself because of conflict of interest. Should be under control of this board. I think we can stop here. This slideshow have a lot of about WHO, which I hope I can discuss with you later on. And in Ma'ata, I passed to you a last lecture about all the declaration steps, but here just a revision to all of it. Fine. So maybe hopefully I can find the other file which this is in Arabic. All what I mentioned to you in English here in this slideshow in Arabic. الصحة والدستور. I found it. Inshallah, you found it clear and almost same. If you miss anything from my English pronunciation accent, you found it here in Arabic for easy reference. All what we have discussed in details. The same, yes, still here. Fine. Hopefully it's clear, and I'm sorry about my accent, my pronunciation. Sometimes maybe I fast. I hope I have feedback, but the problem here with the video show, you cannot have feedback like in a lecture. Assalamu alaikum.